Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I have a interesting case to start with here, and we're going to try to add to this several other cases we've done in this method of removing the lower 6-year molars on a lot of these class 3 cases and avoiding the surgery, the main jaw surgery, and doing it. This has been very, the lasting ability is great. We've not had to redo any of these class 3 cases that we've started and done, and we've done a whole bunch of them, and it works great. And I want to show the benefits of this, and we have a number of these cases, so we got a lot to back it up with, and it works. And if you want to try it, go ahead and try it. It's you say, well, it's a shame to remove the permanent 6-year molars on the bottom, but we don't do it now unless you've got second molars and wisdom teeth in there. And if you do, you can slide those other teeth forward part of the way to correct it and bring the anterior teeth back where they need to be. And you use class 3 elastics a lot of times in here, where you're actually pulling the upper anterior teeth forward, and you give the tongue a lot more room than you do if you do the case strictly by reducing the lower jaw. So let's get on with this, and I'm going to try to show it to you as quick as I can. Let me get this little deal working here. Now, here's a young lady. She's obviously Oriental, and she is apparently have been breathing through her mouth a good bit. When you look at the size of the upper arch compared with the size of the lower arch, and she is full in the face and will still be fairly full in the face when you get through with the case. It'll amaze you. You can do this and you won't even hardly tell any difference in the facial profile across this part of the mouth up here. So let's go ahead and go to the next picture now. I'm going to go through these x-rays, and we've lined them all up on one page. If you're looking at this on your telephone, you may have to put it on a computer to see it. I'm looking at a large computer here to do this. So we're coming, we have good wisdom teeth over here, and you can see the 6-year molars all right. It's been filled, no problem there. But if you took something else out in here, this 6-year molar really doesn't have room. This wisdom tooth doesn't have room to come in, and this one neither have them. So when we remove this, we're going to move this forward some, and we're going to bring this back some, and we're going to use some class 3 elastics in doing that and pulling this back to finish that up, and that brings this further forward up above. And I think this is why we have very few relapses. I've not had one in any that we've done. So let's watch this. So here we send it back, and they take out the 6-year molar. Now, a lot of times your dentist who's referring to you will balk at that. I've got a case where the dentist just would not take the teeth out. And I said, well, do you mind if I got somebody else to do it? He said, no, I don't want anything to do with it, though. So I got an old surgeon to take it out. They removed the permanent lower 6-year molars, and I had that young lady go back to that dentist about every 4 months and have her teeth cleaned and checked, and I'd ask him about it at dental meetings. Now you watch this tooth move forward. See, we're going to take it out here, and it's halfway over there now. See, if you see that little loop in that area right there, that brings the root forward as you bring the crown forward. You say, well, how does that do that? It's hard for you to see it here. We're already halfway into that loop. I think I can change this back and forth here. And I'm going to see if I can make this white screen. And this, I'm going to say draw a 6-year molar here. And well, that's the one we're going to take out. And we'll have a bicuspid up at this part, around the mouth. And then we're going to have the the second molar back in this area. Maybe that'll look like a tooth to you. And your wisdom tooth can be kind of impacted, and you'll be able to use it anyway. And we have no problem in straightening the wisdom tooth up. You put something in there if you want to and tilt it up. Now, we're going to take this out right here. So we're going to have a space in there. I can't erase that very easy here. So we're going to start moving this together. All right, I'm going to just drop down here and show you. We'll have an arch wire come through this area, and right about the middle of this, we drop down and make a loop like that, and you go around the arch and you do the same thing over here on that side. But what you do here is activate this way down like that. All right, when I put this part in here, then your loop is somewhere out in the center of this, and it's going on around. But this was going down, and when we activate it, it tightens the spring in this loop right here. In other words, you come in here, you drop down, and you do it, and you activate this, and now when I bend this up, it tightens the spring. And so that spring is trying to bring the roots of the teeth forward. If the roots get ahead of this, you've got too much of this on it. If they don't keep up, you tie it back by running the tie back through the loop and come down the last. And as soon as you get the wisdom tooth in there, you hook it up, and you can do it the same way. Actually, you can come out here and do like that on the wisdom tooth. And this arch wire you can bring down, raise it up, and it'll take the wisdom tooth up too. So this is some of the moving the teeth is a simple, it's the easy part. The thing is understanding and knowing that you can take a class 3 case in many cases, and I'm going to show you a whole bunch of class 3 cases we have corrected by removing the lower 6-year molars, and we bring the teeth forward in this fashion right up here. So let's go back to our x-rays, and this is a little further down the line, you see. Now watch this wisdom tooth right here. Watch that wisdom tooth. We're going to pull this tooth forward. Now this tooth moved away, the 6-year molar, the second molar moved up away from that, and this tooth is in the open now. Now you see the change of the angle of the tooth. It was in that, like that fashion, and the way it was growing here, it changes And gradually, as we pull this away, we free this up, and that follicle will straighten that wisdom tooth up. And as it comes on in, and we end up, this is the last x-ray I have this, but this young lady's wisdom teeth came right on in on that. Nearly everybody's does, but you can correct that by putting the band block on there, just a little deal, and come in with something like that, and then you bring it up, hook it, and it'll straighten that tooth up. All right, and this closes up, and we frequently would come in with some, we didn't need all this space. In other words, when we first started, we had a space in there that was as big as that 6-year molar. And so once we would pull with class 3 elastics up here, and that brings these front teeth forward to some extent, and that gives you more tongue room, and this is why this succeeds. All right, let's go on and go to the next slide right here. This just shows you the upper arch on many of these cases is smaller than the lower arch, and it tends to drop inside of that, and the upper arch tends to get inside, and you can tell a little bit from this. Let's go to the next deal, and here is the upper arch when we started, and here it is after we more or less finished the case up. And you can see if you start out breathing through your mouth or keeping your tongue in the lower arch, it'll get bigger than the upper arch. And mine has done the same thing, just a very little bit, but you bite your cheeks and all this with that. So anyway, we enlarged the upper arch and lined it all up. And I want you to know this. All the teeth are here. Here are the wisdom teeth on the upper arch. And there, the lower wisdom teeth will be gone on the case. Now here's the lower, and we take this tooth out right here, the 6-year molar, and this comes up till we get to class 1, and this goes back until we get to a class 1. Or if you want this to stay absolutely still in this part of the mouth right here, you can put a little pin in the cortical bone and bond it to this tooth right here. Now you've got a space there, so you can bond in here. You get up there pretty close. You have to finish it with a class 3 elastics or something of that nature. But this space, it'll come together at a class 1 relationship, and in doing that we bring this back some, and we also bring the upper teeth forward some in the case. I'm going to go back here and show you. We're going to bring the upper teeth forward with this class 3 elastic coming off the bottom, and it'll pull forward on these teeth. And so this tends to bring these teeth out a little bit, and that gives you additional room in doing the case. I'm taking a little longer than I intended to, but here we are. We've finished up the upper, and we've got it closed up. We like just a little bit of correcting the wisdom tooth coming in, and you can leave it alone if you want to. The wisdom tooth will come in and it'll butt up against that tooth, and then this kind of this occlusion will bring it back in. So you don't have to stay there till you get everything totally done. But here we are after we've got that far. And this is the way the young lady's teeth come together. The vertical dimension did not change a great deal. She's got her head kind of cocked up at an angle. If you bring her head back, this looks better than it did when we started. And if you doubt this method of treating, try it. All I ask is just try it. We've started doing this years ago, and it works really good. But there are very few dentists I know that actually will go in and recommend removing the lower 6-year molars to correct the case, even if they don't even think about it if they don't have a wisdom tooth. And you want to have a good wisdom tooth. You don't have to have the wisdom tooth in place. You can always straighten up a wisdom tooth 10 years after you get through correcting the rest of it. You want to, I mean, well, you usually can do it before you go. I finish a lot of these, and then I'll come back and bond a little tube and put that deal on the wisdom tooth, something like that, and this tooth will be, and we can come out here and when a person has no braces at all, you bond a little wire and hook that, and you can tuck this wisdom tooth up. So try this, and don't say I won't do it because I'm afraid that the wisdom tooth won't come in perfect. You can perfect the wisdom tooth years after you finish the orthodontic case, if that's necessary. So I hope you'll take this and go with it. It is a better way, really, than doing the surgery. It holds up. I've not had to redo a single one of these cases. We've done a lot of them over the period of years. So I'm going to sign off now and say goodbye, and then I want you to join our group and subscribe to it, and we're going to try to continue this as long as I can, and I'm going to think that's about, now here's where we started, and you got a little reduction in this, but not, we have a good looking face when we get through with it. And that's it, and thank you for watching, and I'm going to come over here and click this off.